Good evening, everybody. I want to begin by acknowledging that we're here on Treaty 6 lands and the traditional lands of the Métis, Dakota, Lakota, and Saulteaux. My name is Lenore Swiston, the media host of Civically Speaking, and it's a true honor to be here. And I'm here together with my colleagues, Anika Masri. Anika, I'm messing up on your name. I tell you, we got some nerves here. We're on a new station. This is all good. So I'm here with Anika Misha, and we've got Rashid Ahmad, who's the host of Voice of Saskatoon behind us. Our shows are aired weekly on CFCR, Saskatoon's community radio station, 90.5 FM on Sunday mornings and Tuesday evenings. And together we are here with Majura Ghosh and Jeff Jackson, who are in the background with us as well. And we have Ian Roach and his colleagues that are here as well with No YXC, a new live television station to the digital networks that we have here. So Anika, over to you after I've mashed up our beginning.
Thank you so much, Lenore. So we would now like to welcome our panel members. So our first panel member is Dr. Hassan Masri, critical care physician and associate professor of medicine and critical care at the University of Saskatchewan. Our second guest is Tracy Muggli, Executive Director of St. Paul Hospital and a social worker by profession. And our third guest is Pamela Golden-McLeod, Director of Emergency Planning with the City of Saskatoon. And our last guest today is Dr. Kendel, retired physician, former registrar of the College of Physicians and Surgeons of Saskatchewan, and current healthcare consultant. Welcome, and thank you so much for taking your time out of your very busy schedule to join us here tonight. So this forum will be conducted essentially in three parts. So the first part, we will have two key questions to ask to each of our panel members to start this panel session off. Our second and most important session is taking questions from our audience, and you can either join us through Facebook or you can join our conversation on Twitter using the hashtag #BeatCovid19YXC. Everyone will be required to have a Facebook ID in order to ask a question on Facebook. And the third part is we'll give our panel members a minute or two to share their closing remarks, reflections, and guidance going forward. Our role as hosts would be to keep the flow of the conversation going and ask the questions to our panel members. And please use the comment section down below to ask any questions or concerns you might have for our panel members here tonight. And thank you so much again, panel members and audience members, for joining us for tonight's show. It is being recorded, and you can definitely follow up on our Facebook page, The Voice of Saskatoon, or Facebook page, Civically Speaking. And yeah, let's start this conversation, and over to you, Lenore.
Yeah, thank you so much. It is a true treat. And Dr. Masri, you almost gave us a heart attack because we know you're busy and you're running into the studio. So thanks for being able to join us. We're going to start with you, Ashley, with this first question. And we're hoping that each of the panel members might want to jump here with your perspective on it. So in the next couple of 2-3 minutes, please share your perspective about the current situation with respect to COVID-19 in our city and province as a whole. So just your general perspective, Dr. Masri, on where things are since the last time that we had you on the panel here before Christmas.
Yeah, absolutely. First of all, thank you so much for having me this evening, and sorry for giving you the scare with my delayed appearance, but it would not be me if I did not stick to my Middle Eastern time and arrive a minute or two late. Again, it's my pleasure to be today with the panelists, and special welcome to Dr. Dennis Kendel, who I look up to and consider as one of my role models as a physician, but also in his social activism in our province. Here in Saskatchewan, I think we are, as everybody knows from the numbers, we are unfortunately the highest number of COVID-19 per capita in the country. And I think this number is quite striking for me for two reasons. Number one, Saskatchewan actually should not have the highest number per capita in the country for many reasons. But one of them, when it comes to the fact that we do not have an international airport, We do not have a lot of international travel compared to, for example, Ontario, Quebec, and Alberta. We should, in theory, be ahead of the rest of the country in terms of our numbers, and we should have a better handle on this pandemic. Of course, similarly, one of the things that I think is putting us behind is the fact that we are probably the province with the least amount of stringent restrictions, and I'm sure we will talk about that quite a bit in the next few minutes. But I do believe that we need to continue to advocate for change, and we should not accept to continue to be the worst province in terms of our control. I do think that people in the province are doing their best, and I know that most people are continuing to do their best to follow the guidelines, but we will continue to help and educate those who are not following the rules to the best of their extent, and to those who don't believe in the rules or don't believe in the disease. I think it's about time that they do, but again, we'll continue to use education and kindness towards those to bring the numbers under control. I am obviously encouraged by the numbers in the last few weeks, but I have to say, on a personal note, I have been an intensivist or an ICU doctor for the last 6 years, and there are two events in my career as a physician that will stick with me forever. One of them, obviously, the night that I was on call as the ICU physician during the Humboldt Broncos bus crash 2 years ago, almost 2 years ago now, or a bit over that. And the other day is a few days ago, when I was the intensivist at the hospital here in Saskatoon, and there was so much, bad news and sad news that I had to break to families. It really, at the end of the week, I felt quite emotionally drained. And I have to say that week was the longest and the toughest week I have gone through in my medical career. So I am, as a physician, very concerned. And I think we need to continue to advocate and be loud and respectful in our advocacy.
Yeah, thank you so much, Dr. Masri, for your opening remarks. I'm going to ask Tracy Muggli now to some of your thoughts again on just your perspective about the current situation with respect to COVID-19 in our province and our city.
Yeah, a lot did change since our last gathering together, and unfortunately, it wasn't in a good direction. We saw big increases in the number of cases and the number of hospitalizations, and what we've also seen that I've really been witness to is our system's ability to bear any more weight. And what I mean by that is that we were reaching the point of saturation. We have hundreds of people that are redeployed into jobs that they have not done before and have had to pick up the pace and learn how to do things, and also changing their lives, being able to reorganize their childcare and their, everything, where they even park, everything. Even things like staff having to fall into an adapted training to become ICU proficient to help Dr. Masri. It's been incredible to watch those pressures. And even within the system itself, I think we all heard last week about the overdose situation, and that is very real. And what really struck me about that was yesterday I heard Dr. Maurice Markington on CBC, and Alicia asked him, what do you think we can do about this situation? And I could just hear this tone of deflatedness in his voice. He said, I just don't know. I just don't know what we can do right now. And I think that's how some of us have been feeling. With the higher numbers, we've had outbreaks within the hospital. And I can't tell you how difficult it is to run a hospital and get people where they need to be when you have an outbreak right in the hospital on a unit that is not meant for COVID patients. The the work that has to go into making sure you have non-exposed staff, and how to be able to organize that is very taxing, and it's resulting, I think, just overall in a lack of patience from not our folks, but in our community in general. And we had a couple situations the last couple of days that really brought that to a head with people coming in that are non-believers that there's a pandemic, and creating quite a situation. And you can only take so much, but on the good side, numbers have gone down. We're doing point of care testing now, so everyone can get tested more quickly. Vaccinations are beginning, and some of our staff have had vaccinations. Every long-term care facility in Saskatoon has received first doses, and about half of them have received second doses now, some personal care homes as well. People over 70 out at Whitecap, Dakota First Nation. So there is some light there, and we have to hang on to that sometimes to bear with the rest of it.
Thanks so much, Tracy. And you're right, a lot of stuff has really changed since the last time that we talked, months later, and we're grappling with a whole bunch of issues, as you guys had discussed last when we were together. Thanks so much to everybody tuning in here to Beat COVID-19 Part 2 here, and we've got our panelists, and we've heard from Dr. Masri and Tracy Muggli here on a question that I'm now going to bring over to Pamela Golden-McLeod. And it's just, in the next couple of minutes, your perspective just on the current situation with respect to COVID-19.
Well, thank you very much, Lenore, and thank you for having me back. I am really honored to be on with the other members of the panel. These are people who I look up to and I learn from, and very excited to be here. From an emergency management framework, in emergency management, there's 4 different pillars that we work on, and, mitigation, preparedness, and response and recovery. And, one of the things we're always doing is assessing where are we at in this. And I had a question the other day about, when are we going to get to the recovery phase? And we are still so deeply into the middle of the response that, that's been our main focus, and really still focused on that. We're still, assessing, in all of the sectors here in the city, do they have the key resources they need? And that's mainly staff. That is primarily staff. And so when these outbreaks occur, we are assessing for at what point will that sector be overwhelmed, and do we need to reach out for additional supports? The other thing I'm seeing people struggle with, and I'm seeing organizations and business struggle with, is around the COVID fatigue. And I think everybody's aware of that. This has been a long time coming. And I try to think, is this the dead of winter, cold of February speaking, or is this, how things are going right now? And I think the key thing for me, foundational to all of the conversations we have, to all of the information we share out from an emergency management point of view, to the partnerships we work with, is we need at the foundation to be really focused on empathy. When I look at some of our frontline workers, and I look at, for the city of Saskatoon, our roadways crews, our wastewater crews, our fire department, the police department, the healthcare workers, all of these people have been in the workplace from the start, dealing with change after change after change. And we have to be empathetic to that. And then we have people who, because of, factors, they're having to self-isolate, and we need to be empathetic to that. And we have people who've been working from home, and we need to think about being empathetic from that. And so I think it's so important that rather than us see each other as somebody having more privileges or somebody having it easier, we have to really think with empathy, what's it like for that person, and how has it been for that person, and really base our response on that, and base how we work on that. One of the things that we're seeing from an emergency management point of view is the cascading impact on other emergencies and other situations. And I think right now we're in the middle of an extreme cold weather. And we do have a cold weather strategy here in Saskatoon, but this is a very dangerous time for so many of our residents. And our emergency shelters and our emergency warm-up locations and the places that normally people can turn to are limited because of COVID. And so, I just want to give a shout out to those organizations doing this work this week. They have gone above and beyond. And I do want to share that, when you look at organizations like Sahuitan, EGA, it's Prairie Harm Reduction, these organizations have changed the way their outreach workers are working. These workers are out from 2 a.m. until 5 a.m. finding people who might be out in the cold and finding them locations to go. And I think it's really going to be important that we acknowledge that and we realize how hard those people are working and the challenges with COVID now. You know, when you find somebody who is living on the street or is experiencing homelessness, and they have symptoms of COVID, that's a very complex situation. And many organizations have worked hard about how they can help keep those people safe. So I think right now, you know, we're still in the middle of it. And, you know, I know at the start, everybody talked about we're in a marathon, we're not in a sprint. And, you know, I'm starting to think we're not in a marathon because people who run marathons train for a long time. And a marathon has an end date. Someone was telling me recently about these races where they just run until they're the only person able left to run. And that's not something I'm volunteering for anytime soon, but I feel like that's where we're at. And so really just looking at focusing on what we can control and moving one foot in front of the other. And that's what we do every day. Come into work and say, what can I control today? What can I get accomplished today? And just keep moving forward every day.
Yeah, thank you so much, Pamela, for that. And you make such good points there about just where we're at as we're all sitting in our homes, feeling the draft from the outside, you know, and we're having that to contend with and you know, thinking about all of those that are out there having to wear through this. And so hearts out to so many families affected by this. I want to introduce now someone new to our panel, Dr. Kendel. And Dr. Kendel, so much appreciation for you and all that you do and have done. Former registrar of the College of Medicine, and now working as a consultant and somebody very active as well on social media in respect to COVID-19. So we now give this over to you for some opening comments.
Thank you very much. I guess one of the things I've reflected on over the past year as we've been in the midst of this pandemic is I was privileged back in 2015 and 16 to be part of the panel that recommended consolidating 12 of our health authorities into the Saskatchewan Health Authority. So Athabasca remains an autonomous entity, but the other 12 are unified. And I'm just so thankful that the government did accept our recommendations and created the Saskatchewan Health Authority, because having the capacity to coordinate services seamlessly province-wide has been so crucial, and it would have been infinitely more difficult if we still had the old structure. One of the last things I did in terms of a formal appointment was serving for 17 months as the interim CEO at the Health Quality Council. And during that period of time, we were focused on the social determinants of health with a particular focus on Indigenous health. And it's absolutely the case that people who suffer, you know, from homelessness and from food insecurity and have had, you know, suboptimal early experiences in life suffer a greater burden of illness. And during this COVID period, that has been exacerbated. You know, I would say that I acknowledge right up front, I'm a very privileged person. I live in a warm home. I can work from home. And I think about the people in Saskatoon who are homeless or have home, you know, housing insecurity, food insecurity, and it's very, very tough during this pandemic for them, and we need to do whatever we can to mitigate that harm. And then finally, I guess I want to say that in any difficult situation like this, we have to anticipate that it could get worse. And I worry a great deal about the impact of the variant viruses that are now in the country. We only have 3 cases of the B117 variant, but across the country, I think last count there was about almost 400 cases in the country, and it'll come here. We'll probably get all 3 variants. You know, it just inevitably comes. And the worrisome about it, the variants, is their increased transmissibility. We have functioned under a definition of contact of being in the presence of a person for 15 minutes. And some of these variants, transmission can occur in proximity with a person in a matter of 3 or 4 minutes. And so that's going to radically change the community transmission, and I worry about it in our schools. It's going to be a real challenge. So those are my thoughts.
Thank you so much, Dr. Kendel. Just really a delight to have you join the panel. And thanks to all of our guests on this opening round of Beat COVID-19 Part 2 here, where we're kind of catching up on where things are at today with respect to it in our city and in our province and beyond. Anika, over to you now for the next question.
Thank you, Lenore. So, panel members, beginning with Tracy Muggli, what do you see as the best path for our community regarding beating COVID-19 and why? What are some things we really need to consider along our path going forward?
Boy, a magic wand, and obviously we still don't have good enough adherence to people staying home and not having contact with other people in a safe way. I guess, that became very clear to me today and yesterday when we had somebody present at the hospital who was not wanting to be compliant with some pretty basic parameters of how to keep us all safe. So I know that this is just like a broken record, but we really cannot let up on this. It's going to take a long time to get herd immunity from vaccination. We're making assumptions that everyone is going to step up and take the vaccination. I sure hope so. I was talking with colleagues today about making sure that we can address vaccine hesitancy and what can we do to make sure that people accept the vaccine. And I think that will take things like, as Dr. Masri did, being public about it, and people who are experts, people who are scientists, people who are public figures, people who are elders, people who are role models in their community need to speak out and talk about taking the vaccine and its safety and the importance of building that herd immunity. So I don't really have a clear sense on what the vaccine hesitancy is like in our community. I feel like everyone's really, wanting to get the vaccine, but I know that there are certainly people out there that will not be interested. So that does worry me. So I think a lot of PR and a lot of leadership around vaccine, once we get into that phase where we're having public big mass vaccine centers. And I think we just have to, like Pam was saying, show empathy and just try to support each other as best we can. Our emergency department folks have been having a really tough time over the last few weeks. It's just really bearing on them, trying to manage the numbers coming into the emerge. And as you can imagine, as I said earlier, we're having other issues like overdoses, etc. So trying to lift each other up and support each other. We got a big stack of really cute letters this morning from kids at Chief Whitecap School, a grade 3 class. And they wrote letters to our staff in the emergency department, in our housekeeping, in our food services, letters of, you guys, thank you so much for keeping us all safe. Thank you for fixing my appendix, or I might still be sick in the hospital. They're really cute. Anyway, we're laminating them so that they can be safe and cleanable. And we're going to hang them in the emergency department and other places in the hospital so that our staff know that the grade 3 kids at Chief Whitecap School are thinking about us and caring about us. So I do believe empathy is a big piece that will get us through and supporting each other in whatever way we can. And also Dennis Kendel's tweets.
Perfect. Thank you so much, Tracy. Over to you, Pamela.
Well, you mentioned there'd be some tough questions, and this is a tough question. And again, I think I'm working really hard right now on chunking what we can control, because I feel like at this point in time, it does feel so big, and it does feel like it's been going on so long. So I think I'd like to speak about how we can chunk things and manage them that way. Because when I hear the question, how can we beat this? I get a little overwhelmed. And I think, you know what, that is so big. I'm not sure if I can even begin to answer that, but I can chunk it and say what I need to focus on right now and what I think others can focus on right now is, you know, let's review all the safety protocols. And I speak of our workplaces here in the city and our volunteer organizations, because all of these sites are so essential. And I think it's time for us to take a step back and review our safety plans, see if we need to update them. I'm really conscious of what Dr. Kendel shared around the variants and the transmittability and the concern that we have, you know, gotten a little bit lax sometimes in following the public health orders. And we really need to go back to those public health orders and renew them and follow them as carefully as possible right now. And that's what I feel like I can chunk and control. We can focus on that. We can focus on getting that information out. The other thing we can chunk and control, I think, is that we can look at getting information out, accurate information, and having good open conversations about vaccines. And I think Tracy's right. You know, we need to be frank and open about this and how important, and get those people who are in leadership roles and who are influential to talk about the importance of this. And I think we also have to acknowledge that our partners had to make really hard decisions about who gets vaccines when. And I know I would never want to be part of that discussion. And so, you know, I think those are hard decisions to make. And I think we have to look at all the people who've had to make so many hard decisions. And let's just if we keep putting our foot in front of each other, and if we keep being safe and following the safety protocols, then some of us can wait a little longer for those vaccines because we can keep ourselves safe. But there are people in our community who will be deeply impacted if they get COVID, and that will deeply impact our health partners. And so we really have to keep that in mind. So thank you.
Thank you so much, Pamela. And over to Dr. Kendel.
Sorry, is it me?
Yeah.
Yeah, okay. I missed. So I just want to say, I'll follow on what Dr. Masri said about, you know, complying with the public health protective policies. It's interesting, under the Public Health Act, they're actually called orders. They're issued by our Chief Medical Health Officer. And we have a government that has been reluctant to do what it considers economically damaging shutdowns or closure of activities. But the reality is that we've kept things open more so than some other provinces, and I think we've paid the price for that. And we may indeed have to accept some further restrictions if indeed the numbers begin to rise again as variants come into our community. I do want to just say that these orders are not, you know, suggestions. They are actually rules. And I feel sometimes that I see citizens in our community stretching them. It's like if the speed limit is 100, you know, between here and Regina, I can drive 120. And I see more elasticity than I'd like to see. Still, you know, sometimes you see a whole family going into a grocery store to go for groceries rather than just one person going in. I like to. My wife and I support the restaurants in our community, but we do takeout. We went for lunch at a restaurant relatively early on after the lockdown was lifted, and we got a phone call. There had been an exposure. Thankfully, we didn't get the disease. But after that experience, we just said, you know what? We're just going to order in food and enjoy the food in our home, and we're just not going to go there. And so having the permission to do things doesn't mean we should necessarily do them. I think we need to all keep home as much as possible. Obviously, people need to go out to work, but non-essential activities we really need to refrain from engaging in.
Thank you so much, Dr. Kendel, and over to Dr. Masri.
Thank you. Before I answer, I have to acknowledge that as active as I am on social media, I am only active on Facebook and on Instagram. And in the last few months, I have been forced to add Twitter to my arsenal because of Dr. Kendel. I did not want to miss out on his tweets and his wisdom. And so single-handedly, he has forced me to be active and join Twitter. Now, to answer your question, I think it is a really tough question, but I also think that the first thing to answering this question is that we have to actually believe that this beating COVID-19 is a possibility. And it is a possibility, and we don't need to imagine this possibility. We could actually just look at Australia, Iceland, Sri Lanka, Singapore, Taiwan, and the list is actually quite long. And and New Zealand, obviously. And so beating COVID-19 is a very possible thing. It's not actually a dream or something that we could only dream about. And it's not something that only rich nations could do. I mean, a nation like Canada is certainly financially and economically is more rich than a nation like Sri Lanka or Rwanda. But the reality is, we need to also look at these nations that have managed to succeed in their fight against COVID-19 and look at what they all have in common. And what they all have in common is the fact that they all collectively, government, people, organization, the system, agreed that they're willing to take bold, aggressive, and sometimes painful measures that may appear painful in the short term. But the reward is extremely, extremely appetizing. And, looking at concerts and people going back to work regularly in Australia makes me wonder, and I always wonder, why can't it be us? As a Middle Eastern young man, I remember when I used to come back from school, and maybe some of the audience could relate to this, and I would have a 90% in my on my report card, and my dad always said, "Okay, well, that's good, great, but why 90%? Why not 100? How come the other kids in the class got 100?" And so I think that we have to have that spirit that why are we okay with the fact that we have an average way of beating COVID-19? Why are we satisfied that what we're doing is just better than the United States? Why can't we compare ourselves to Australia and New Zealand, who are quite common? They're quite similar to us, and many people will bring up the point that they're islands, and I would argue that we are geographically pretty isolated, except the United States, and the border has supposedly been closed. And so I think that the first thing that we need to do in order to beat COVID-19 is to understand it's a possibility. The second thing is that we need to understand that beating COVID-19 cannot be an individual task. We're not going to beat COVID-19 while 60 people freeze to death in the streets of Saskatoon. We're not going to beat COVID-19 while the positivity rate in Indigenous communities in the North is 50%, 60%, 70%. We need to do the right thing morally, period, regardless of the fact that that not doing the right thing will actually harm us. We need to do the right thing, period. But not doing the right thing not only is not a morally the right thing, but also is going to harm us, because the COVID-19 fight is a fight where we all win or we all lose. It's not going to be that Masri and Tracy and Pamela and Dr. Kendel are doing their thing and so they're safe. Rather, we all drown or we all succeed. The last thing I will say in this fight is we all need to speak our mind and advocate for each other, and to refrain from what I think is an unfortunate language where we divide each other. These people are only advocating for this because they could stay at home. Because they could work from home. Or these people are advocating for this because they could. Look, the bottom line is we all are together, government, organizations, and people, and we need to continue to do this together and understand that it is actually possible, and that in medicine, sometimes we need to take painful measures so we could have an outstanding result later on.
Thank you so much to all our panel members for such insightful and thoughtful responses. And now over to you, Lenore.
Yeah, thank you so much. That was great. Just so appreciating the wisdom from this panel. And I know we're getting wonderful views here, and I know that people will be viewing this all through the family weekend and Valentine weekend. So we have a lot coming up, and I want to speak to that, as panel members, because we're going into another kind of season where typically we would come together, right? This is the week where it's the groan zone in winter. We're getting a little fatigued from winter normally, never mind having a pandemic that we're going through. On top of it, we've got Valentine's Day. So there's all of that love and romance in the air and people desiring of that, right? And so, when we go to this next kind of session, we're going to throw this out to the audience right after this. But to start us off, one of the questions that has come to us earlier, and you've all have touched on this, but thinking about this weekend coming up and that, what are some things that we really need to think about with COVID-19? Dr. Kendel, you talked about, the variants, and we need to be thinking about that. Dr. Masri, you talked about how we need to be thinking about each other during this time. Pamela and Tracy talking about, people out on the streets and just that we got to be thinking there. What's some practical things that we need to be thinking about as we head into this weekend? And I'll start with you, Pamela, as you are kind of the head of emergency services for the city of Saskatoon.
I think we each of us need to go back to those public health orders. We need to go back to the recommendations. And I think we each need to take a good hard look at what we're doing and how we are following those, and what can we be doing better to follow those. Dr. Kendel, referenced, those are not suggestions. That's the law. That's what we need to be doing. And there was a skit on Saturday Night Live last weekend where some people were sitting around the Super Bowl and talking about how good they were doing and how they were following all the orders. But of course, as the skit went along, they were not near following the orders. And I think that's what we need to do, is I think we need to refresh and remind. I am also going to suggest that we also, all of us who are in privileged positions, can do something to help those who may be stuck out in the cold this weekend, whether it's contacting one of the agencies that supports and seeing what they need, whether it's advocating for those individuals. And I learned something from Sarah Dawn at Sahuitan this weekend. They reference the people they work with not as clients or customers or residents. They call them our relatives. This is how we helped our relatives. And so I think this weekend, if we can all think, how are we helping our relatives around us? That's what we need to do. And the other thing I'm going to suggest is that right now, when people talk, I hear them doing a self-risk assessment. So assessing the risk to themselves. You know what, if I go out to the grocery store and if I get COVID, I'm young, I'm healthy, I'll be fine. But I think I want people to think about doing a community risk assessment. Having heard what Tracy shared today, having heard what Dr. Hassan has shared today, when you go out, you need to assess whether the risk you're taking is worth it to your community and to your relatives. Is it worth it if you get COVID and put more stress on the healthcare system? Is it worth it if you pass on COVID to one of our relatives in the larger sense of our community? And I think that's what we have to start thinking about. And we need to get back to the basics of following the rules as closely as possible, because as Dr. Kendel said, I am also very concerned about the variant and concerned about how quickly that could spread in some of our essential services and critical services here in Saskatoon, and the deep impact that could have. When we look at, outbreaks that have occurred in places like the food bank and like, the Friendship Center and like the Lighthouse and like the Salvation Army, these are critical to our health and well-being. So you getting COVID and possibly passing it on to one of those people, that's a risk that I don't think our community should be ready to take. And if you're ready to take that as an individual, you need to think about your community and whether your community can handle that risk.
Yeah, thank you so much, Pamela. Really good words of wisdom there, I tell you. Dr. Kendel, building on what Pamela had just said, some thoughts kind of as we head into the weekend.
Well, Valentine's Day is a time of love, and I think it's also family weekend, which refers to, the bonds of family. I'm a member of a Christian congregation in the city that is mostly elderly people. My wife and I are probably among the younger members, and I'm really struck during this pandemic how isolation and loneliness has impacted many of our members. And so we make a real concerted effort to, contact them by phone. It's amazing. We've enabled a lot of these people to learn to use Zoom and other meeting forums. So we have virtual meetings where people share what they're doing on a day-to-day basis. And I think it's important that we be mindful of people within our circle of contact or our circle of fellowship who are isolated at this time, and actually make sure that we find a way to connect with them. Just the good old phone actually is quite amazing as well. Pick up the phone and talk to people, and it really means a great deal to them. So I think that's a good message for this period of love.
Yeah, thank you so much, Dr. Kendel. And just for people that are tuning into this COVID-19 kind of, how can we beat this thing here in Saskatchewan? And that we are in the midst of this conversation with a great panel, and we encourage you to field some questions. We have all kinds of channels that are open. If you have any thoughts, comments, or just want to give a shout out to anybody, please do utilize them. Now I want to go over to Dr. Masri, just on your thoughts of wisdom as we go into the weekend. And we're queuing up audience questions as we're here, and we can't wait to get to them. So Dr. Masri.
Yes. I think that, my message about this coming up weekend is that just similar answer to the previous question is that in order to see what's going to happen after this coming up weekend, we could look at to what happened after the weekend of Thanksgiving, after Christmas, and after every other holiday in the last 10 months. And I think that, it's important that we learn from our mistakes. I think it's sometimes we make mistakes, but I think it is something that we cannot continue to repeat. And we know that in Saskatchewan and in all of Canada, really, we spent the entire month of January just keeping up with the rise in numbers, the rise in death, the rise of everything related to COVID-19 from Christmas. We need to understand that if we truly love people, i.e. Valentine's Day, and if we truly love our families, family weekend, etc., we need to understand that loving them means that we get this under control. So people can have jobs, so people can have a financial well-being, so people can go for their mammograms and have screening for their possible breast cancer, so people can actually live. So, and I think that we need to really show the meaning of love. I mean, I think that flowers and roses and dinners are something that are beautiful. And certainly if it wasn't for COVID-19, we would all encourage this spirit. But I think the meaning of love, as far as I understand it, is that we truly care about other people. Love for others what you love for yourself. I certainly would love for myself and for my parents and for my family to be safe. And so I love that for other people. And I think we just cannot repeat our mistakes. I mean, we know that, everybody knows that the entire month of January and the rise in the numbers was due to the social interactions over Christmas. We know that a huge number of people did that. We know, for example, in Ontario, and I'm sure Saskatchewan probably has similar data, that 1/3 of Ontarians traveled over 2 days over Christmas using cell phone data. So we cannot repeat these mistakes, and we really make a small sacrifice today so we could have an extremely bright summer in the next few months.
Yeah, thank you so much, Dr. Masri. Tracy, anything to build onto that, just as we're heading into the weekend, just any practicalities that we need to be thinking about? And then we're going to open this up to the audience because we've got some good questions queued up, and we've got our colleague Mahira who's going to be joining us here right away on screen to start fielding some of those as well.
Yeah, I think I'll just build on a theme as it relates to love for university students. Because I have a 5th-year engineering student in my basement, and I'm really seeing the intensity of what it's like to try to study and be in university, not being at the university. And, Ontario, Quebec, they've been talking actually about keeping kids in school and not having a break, thinking it's a safer thing to do. But I do think that everybody does need a mental break, if nothing else, to be able to sleep well, regenerate our brain, our mood stability, and get some exercise. We're just really out of order right now with a lot of our natural rhythms and routines, and I do think that the best way we can show some love over this short holiday period is to actually take care of ourselves and get some good sleep and take care of our health. And that has the impact of rubbing off on others too, because when we're healthy, we're a lot easier to be around too, from a mental health perspective.
Yeah, for sure. Thank you so much, Tracy. Really, really appreciate that. I'm now going to turn it over to Manura, who's going to kind of field a question from that, and he's going to walk you through. So welcome to the screen, Manura. Fire away with your question.
Hi, everyone. It was great listening to all of you. I just have this question, and the question is, considering Canada ordered one of the highest numbers of vaccines per person, why is it so behind on the actual administered vaccine rate? And does the number show our problems in the healthcare system, or is it more on the logistical sides of getting the vaccines? I'll start with Dr. Kendel.
Well, most of the problem has been actually getting the vaccines into the country, because the Pfizer plant, shut down for a while to increase their production capacity, and so the volume of vaccine that we were expected to receive didn't come during that period of time. Within the country, it's interesting that, of course, the Pfizer vaccine, because it had to be kept so cold, couldn't be transported much. It had to be administered where it's actually delivered. And Moderna then could be used more in the north, and it was taken up, and many people in the north were able to get it. But so far, Saskatchewan has done an amazing job of actually using the vaccine that we have received. The other thing about the 5-dose versus 6-dose vials, we did have the low dead space syringes, as I understand it, and we're harvesting all of the serum or the vaccine from the vials. And that will be important going forward. Some places didn't have the proper syringes and they weren't able to use it fully. I do think the Saskatchewan Health Authority has created an excellent plan for immunization. There will be mass clinics. There will be vaccine available through doctors' offices, through pharmacies, through some mobile clinics. The report that outlines the plan, I think, is quite impressive. There'll be up to 2,200 people engaged in actually organizing and administering the vaccine. So I think once we get the vaccines, I think we will do very well.
You're muted.
We get to use the famous "you're muted," Manura.
Now we'll go to Pamela. Sorry about that.
Can I add just a little bit to what Dr. Kendel has said?
Sure.
I think, I really, this is a point that I really wanted to jump in, because I do think that many times prior to the pandemic, and I think this is an important point and we need to talk about it a little bit here. Prior to the pandemic, Canadian governments, both liberal and conservative, have underperformed in investing in Canadian science and technology. And many times we hear voices that say, here in Saskatoon, I've heard these voices many times, why are we investing in a library? Why are we investing in research? Why are we? This is why. Because when you invest in libraries and science and research, you will be prepared for the day when you need them. When you invest in infrastructure that serves homeless, those who have been disenfranchised and disserviced for many, many years, when you have a pandemic, you have a system that works for them. And so I think that one of the lessons that I think we need to understand is that a country like Canada does not need to rely on anyone else in the world to provide them with anything. We have the smartest people in the world. We have all the capabilities in the world to produce anything and everything that we need, but we need to understand that these things need money, and we need to invest in them, and we need to put the political rhetoric, both conservative and liberal aside, and understand that this is not a political matter. This is a matter of sovereignty, and that we could do better and we could have done better if previous governments, right and left, invested more in science and research. And this is, to me, this is, every time I heard the debate about the library in Saskatoon, this came to mind. We need to understand that when we don't invest in every single infrastructure, there's a price to pay, and you never know when that price is going to be paid.
Does anyone else, Pamela or Tracy, have a response to the question?
I think I would just add that I'm with Dr. Kendel. We have an amazing team in Saskatoon. I'm not sure sort of the overall provincial perspective, but in Saskatoon, who's responsible for the delivery of the vaccine. And they are working so hard, you can't even believe it. And they are trying to figure out how to staff 4 mass immunizations, 2 drive-throughs and 2 mass stations, as well as mass vaccine stations in Martensville and Warman. So this is going to require hundreds and hundreds and hundreds of people, 7 days a week, 16 hours a day, to try to staff that and organize that. And that team is working really hard and doing a fantastic job. So I guess I would just leave folks with knowing that I think we're in very good hands here in Saskatoon when it comes to the process and the team that's in place to help deliver that.
And I think I would just want to add to what Tracy said is that from the City of Saskatoon and the EMO perspective, we've been able to work closely with those staff members planning the immunization. And I agree, we are in good hands. Once the vaccines get here, this will go well. Not saying there won't be hiccups, because this is a massive undertaking. And so I think we want to ask for people's patience, but I think we want to ask for people's this is going to happen, but we still need to work on keeping safe. And I think we need to show the appreciation. I can only speak for here in Saskatoon, but the plan looks really good. It looks like they've thought of so many things, and what they can't figure out on their own, they're reaching out for support. And what has amazed me is the support of our whole community. I was requested to do a reach out of finding locations, and we contacted our critical infrastructure, and it was like everyone put their hand up and said, what can we do? How can we support? How can we work together on this? So just like the response to COVID is a whole community, the vaccination is going to take a whole community response. It's going to take, the SHA being the experts on it. It's going to take all of us in our work sites following the orders, and it's going to take every citizen being patient and being respectful of the work that these people are doing.
Thanks, everyone, for your responses. Over to Anika.
Thank you so much, Madhuja, for that great question. And thank you so much to all the panel members for your answers. And the next question that I have for everyone is, what jurisdictions are best prepared to slow or stop the spread of COVID mutations? What can we learn from them to improve readiness in Saskatchewan? We got this as a private message. So just by random draw, I will go with Dr. Kendel.
Well, I think most people are aware of globally. I mean, New Zealand probably has been the most amazing example of how to deal with a pandemic effectively. And it's interesting that my perception is jurisdictions both internationally and within Canada that have been optimally successful were ones that actually acted quickly and decisively when the numbers began to rise. And if you have a sense of complacency that's saying, well, this might not be so bad, we can ride this out, this virus will beat you. And so I think you have to be more decisive and more intrusive into the spread mechanisms early on. And we didn't do that very well in Saskatchewan, unfortunately.
Perfect. Thank you so much, Dr. Kendel. And over to Tracy Muggli.
I think I'll pass my hat over to Dr. Masri, because I haven't studied a lot of what's going on in this particular area.
For sure. Yeah, definitely, Dr. Masri.
Yes, not to add to or repeat what Dr. Kendel said, but I think that decisiveness is certainly an important factor. The other thing is to understand that governments are there to govern, and that I know that I have many family members, and I've been following the situation, for example, in Australia very closely. And in the beginning of the pandemic, when the Australian government and even the New Zealand government decided to take these very aggressive measures, there was an outcry and in the country, and said, what are we doing here? And we're closing a lot of businesses. Economy is going to tank, and a lot of that rhetoric. And what happened actually is, with these tough measures, people survived and economy survived. So I think we need to have our priorities straight, and the jurisdictions that did that did very well. If you all recall, and now it's almost it's like history, but I remember when I used to make a lot of my Facebook videos, a lot of people used to comment and say, what about Sweden? What about Sweden? Why can't we be like Sweden? Sweden is, everything is open and everything is great. And what we know is that Sweden, that took a very loose approach to this, have suffered. One of the worst hit countries in Europe has been Sweden. And so I think sometimes we just have to understand that jurisdictions, not only that took decisive and early, but took brave decisions. These brave decisions may appear to be unpopular, but like my parents have always taught me when they raised me, sometimes they also had to do unpopular decisions. And when you make sometimes unpopular decisions, the payoff is actually great, especially if these unpopular decisions sometimes are made based on science and data, then the payoff is great.
Thank you so much, Dr. Masri. Pamela, do you have anything to add?
Oh, I just like to listen to the wisdom of Dr. Masri and Dr. Kendel on this one.
Perfect. Thank you so much once again, panel members, for your answers. And over to you, Lenore.
Yeah, thank you so much. Just great round of questions, guys. I'm gonna target a few here that we're kind of getting off the side of our desk, so to speak. Dr. Kendel, you've been really, really active on Twitter these days. I want to know what's compelled you to go to social media, and what is the biggest kind of learning that you're kind of tuning into as you're dialoguing around COVID-19, because we're all learning with you. So if people are not following, it's at Dennis Kendel, and it is definitely worth following. But what's standing out for you, Dr. Kendel, when you're looking at your Twitter feed and you're engaging with people? What are you seeing? What are you noticing out there?
Okay, well, actually, I will credit Dr. Susan Shaw for getting me involved in Twitter.
Yeah.
I started, I forget what my start date, it was very early, and I actually didn't use it very much. And Susan talked to me one time and said, Dennis, you actually need to use Twitter more intelligently, and use it as a way to maintain a network with people whom you can learn from, and to access information globally. I mean, it's a quick way to get access to lots of information. So in I think it was 2018, I promised my wife I wasn't going to take on major consulting contracts. I was just going to do small stuff. And so I did actually begin to stay at home and mostly do virtual consulting. I mean, people interact with me virtually even before the pandemic started. And when you sit at home, and I, between working on things that people have asked me to do, I have lots of spare time. And so I go on, not just Twitter, but I go on to other sites, and I learn from that. And so I adopted a practice that's really called curation, of trying to bring information forward that might be of interest to other people. I'm a great fan of Andre Picard, and I always admire when he, hits back at the trolls, reminding that retweeting does not necessarily mean that you agree with everything you retweet. It means that you think it's worthwhile sharing with a broader audience so people can interact with it. And I feel a lot of empathy for many of my female colleagues who really are attacked on Twitter. I have a very low tolerance for people who are just abusive on Twitter. I pretty much ignore them. I just won't respond to them at all, because if you respond to them, you just give them a platform to do more. But unfortunately, many women who are active and are sharing useful information get attacked because they're women, and that's very, very horrible. It's an unfortunate thing.
Yeah.
So I actually I enjoy Twitter as both a learning tool and a rapport, a relationship tool. It brings me in contact with people literally around the world, and sometimes they reach out and we interact through other channels. It makes sure that I don't have boring days.
Yeah. Yeah. Thank you so much, Dr. Kendel. Tracy, I'm going to ask you a pointed question here. There's been, we're watching the numbers. I've been retweeting it. I've been, we post on Facebook and all this sort of stuff. We see those numbers in the ICU units, and we hear about people that are coming in to that. And Dr. Masri, you can imagine what I'm going to be asking you next about what you're seeing. But, what are you seeing in your hospital right now? And what are some of the things that you're going to be expecting over the next few weeks with regards to people in the ICU units and within the hospital itself?
Yeah. Well, on a good side, we have seen a downward trend. I'm very grateful for that. It's been kind of stable all week this week. We really had a bigger drop last week. So when we really run into trouble is when we have units that are on outbreak and we have to actually close some spaces or close beds and then try to, reorganize. But I think this week was the first time I saw St. Paul's Hospital capacity or census for their ICU below 150%. I saw it up to 180% last week, a couple days, but this week I actually saw at least one day where it was 110%. So we do have some hope there, I think, but that doesn't mean there's not other people also in the ICU that, there's people with COVID, people not with COVID, and Dr. Masri can speak to that. But in general, even on our COVID units, our numbers have gone down. There's a lot of people, the numbers are interesting because we have what we refer to as people who have active COVID, and then people who are kind of beyond, I guess, what we would call the infectious period, but they're still in the hospital and in recovery from COVID. So the numbers are sometimes actually higher than they might sometimes be reported, and it's because there may be people who are in recovery. So, but I have to say that last week, a week before, those numbers were up into 60, 70 people, and this week they were closer to 30. So although it's a great relief that those numbers aren't so high, the other thing I think people might not realize is that we try to swab everyone and test everyone. So that means we constantly have people or patients that are under investigation for COVID, and we don't know if they have COVID. So that's where that point of care testing comes in. It's a 15-minute test. And also what's happened since the last time we talked is we're able to do more testing in our lab here in Saskatoon instead of having to send tests to the Roy Romano lab in Regina. So I think a combination of those pieces have been helpful. I guess we're over the Christmas bump to some degree where people did not follow proper orders and got sick and ended up in hospital. Those people are in the hospital now and are hopefully some of them moving into recovery. But that's sort of what happens in a hospital and what the current state is at St. Paul's. We do tend to have a few more patients with COVID at St. Paul's than at RUH. And part of that is because RUH is our trauma hospital and we try to keep, those ICU beds if we can for trauma, et cetera. And we have a more, a bigger general medicine program. So we tend to have more patients at St. Paul's. But it is definitely, I will say declining, but I don't want to get my hopes up too high because I'm one of those people that likes to set my expectations low and then be happy. when
Yeah.
something turns out to be better.
Yeah, thank you so much, Tracy. I mean, and just for people that are tuning in, thanks so much. Tracy's with, St. Paul's Hospital, and so you're getting a really good view of this and having a look, through the whole hospital network and healthcare network. So thanks so much for that response, Dr. Masri. Over to you. You're right, boots on the ground. I mean, it doesn't get any closer than you. Can you tell us a little bit about what that is, that boots on the ground, and what you're seeing there right now? Oops, you're on mute.
Sorry, I figured if I take a moment of silence for my mustache and put myself in.
Yes, your mustache is getting a lot of attention today in all the positive ways. That's awesome.
So I was taking a moment of silence. I think that one of the things that I mentioned in the intro of this meeting tonight is that I truthfully had the hardest week of my career not too long ago at St. Paul's, in one of those weeks that was just described by 180% census in the hospital and a full ICU. And one of the things that I have the unique honor of doing is I get the honor of serving the people of this province in the ICU. But one of the most difficult things for me is when I fill a death certificate for someone who has passed away from COVID-19 and talk to the family, show them the images of the CAT scans and the x-rays and talk to them about how this person is not doing well, and then eventually filling a death certificate for someone, and then the following day or the day after hearing that there was 2 deaths or 3 deaths in the daily briefings. And for the most people in the province, except the family of that individual, for the rest of the million people in the province, it's another person dying from COVID-19. For me, it is someone who I've seen out of breath. It is someone who I've seen with family crying, all family members, and this scene repeated itself too many times not too long ago in one of my weeks on ICU, and I found myself on a particular day. I was breaking the news to a specific family that their loved one was passing away, and the wife started crying. And honestly, I'm extremely used to bad news being an ICU doc, but I did not realize that I also started to tear up with the wife of the family, because she started to tell me about the characteristics of this individual and how loved he was, and what he meant to her after over 40 or 50 years of marriage, and how this individual was the whole world to her. And so I think that one of the things that COVID-19 has done, and the reporting on COVID-19, and I'm not saying it in a negative way, I'm just saying the fact that we keep hearing about 300 cases and 30 hospitalization and 2 deaths, and we hear that every day. It becomes just sort of like almost like the stock market. Is it up? Is it down? Is it up? Is it down? And if it doesn't concern you like the stock market, then you just move on. But the reality is, I get so many messages on Facebook, people saying, I just got diagnosed with COVID-19. I am terrified. I'm scared I gave it to my grandma. I am really worried about my kids. My kid has asthma. My grandpa just died. And so, I keep saying, these are not numbers. These are human beings. And you have to understand that there are people who are dying, in my mind, for no reason. This is preventable. And it has become extremely difficult to watch this over and over again. And I think we need to remind the public, and we need to remind our government that this is personal. These are people, and of course, there's a lot of amazing. I had a lot of experiences of people leaving the ICU and leaving the hospital and messaging me, sometimes privately saying, thank you so much to your ICU team. And I want to take this moment, actually, because a lot of times, and I don't, I don't say this because I'm trying to be humble, but truthfully, I want to be honest that most of the work is not done by Dr. Masri. 99.999% is done by the nurses, by my fellow physicians, by people who run the hospital, by people who clean the hospital, by people who maintain the hospital, by the SHA who helps everything. And I think that sometimes makes me very uncomfortable, the love and the attention that I get, because I really want to be very clear that I am the smallest soldier and an amazing and a much more significant team that takes care of people from COVID-19. And speaking of this team, I want to advocate for something, if I may. My fellow healthcare workers, for the most part, have been eliminated out of the vaccine plan that the government has released. And I think that not because I think they should be, I don't think they should be added because they should be appreciated. Rather, and that's a good thing, they should be appreciated. But I would advocate for them to be added again to that plan, not because I want to just appreciate them, but rather because they are some of the highest risk people. And I would advocate very strongly for my colleagues that they should be added back into that plan. We should be able to tweak that plan to continue. I think it's logical to actually vaccinate people by age, but I think we really need to tweak it a little bit and add those in healthcare because no one can do this alone. And healthcare, as Tracy knows, is a team sport, and not single individual can do this on their own, no matter what their position or their influence. This is a team sport. I tell you what, we can't admit a single patient to the ICU if the environmental staff does not clean the room properly, okay? It can't be done. So, I thank them when I walk into the ICU. I'm like, thank you very much. They're often, not thanked enough. And people like Dr. Masri and Kendel and Tracy and Pamela, obviously, we all get a lot of the attention. But I think there are some amazing heroes that go into a room full of COVID, clean it, make sure that it's clean and appropriate for the next patient. There's so many heroes in the hospital that walk around. No one knows their name. They don't have a blue check mark on Facebook, and they're not as popular as Dr. Kendel on Twitter. But they are certainly more amazing than me.
Yeah, thank you so much for that, Dr. Masri. Again, just words of good wisdom in that. And I know, vaccination and who's getting vaccinated and who needs to be included in there is something that's, I think, is part of everyday coffee talk. So I really appreciate that and the boldness of your statement, because it to us, I think here as we listen, it just makes good sense. So just really, really appreciate that you're saying that. Pamela, I'm going to put you on the spot now with the city of Saskatoon, because you guys have been asked the question about, okay, what about opening up some of those civic facilities? I know that comes through like the housing partnership here in Saskatoon and that. What's the response and thoughts about kind of the role of the city of Saskatoon and some of the steps that they're taking and able to take and where they're treading?
Lenore, just to clarify, so when you say open up civic facilities, are you meaning for vaccinations or what are you referencing? Sorry.
Well, I think it's the one that was in the news around kind of saying, can you open it up for vulnerable people just in terms of the time? So, but you know what? I love your question too. So why don't we get you to answer that one too in terms of opening up for vaccinations? Because that's a good one too, right? It's like, I think there's still a lot of unknowns out there, but where do you go to get vaccinated? How do you, when will it, how will you hear about it? All that sort of stuff. That might be another round for us yet. We don't want to go too much longer in this. I know we've got one more round of question from Matt, but I know that's been one that's been coming up. I know in the public. So your thoughts on that, Pamela?
And I think right now I'm so glad to hear, and I hear regularly from many people, the concern for those vulnerable population right now, those concern for people who are housing insecure, and for those staff members in those organizations who are doing the work. We have had the request come from SHIP, and we are good partners with SHIP, and we really appreciate all the work that they do. We are working on response, and we'll have one probably at the next council meeting. I think one of the things that we need to acknowledge is the expertise that it takes to work in an emergency shelter, like the Lighthouse, like the Salvation Army, like White Buffalo that's now opened, and the expertise of the outreach workers. And while the city of Saskatoon may have facilities, I think one of the resources that is very short right now is the staff. And so that is one of the concerns is, how do you staff something like that? Where do you pull the staff from? Because we don't want to pull staff from those organizations that they're already working. And we know that without that level of expertise, that it would be very challenging to run an emergency shelter like that. I think the other thing that we're being very cautious of is what's the jurisdiction of the municipality, and what can we do within our jurisdiction to support the work of the one actively doing the work around housing insecurity. And so we definitely want to stay within our lanes and not step into the provincial authority around emergency social services. And so working closely with our partners at the Ministry of Social Services to see how can we work together on this and what can we do, because we know that this is definitely a resource that we need in our community. And I think more importantly, it's looking at the long-term plan for housing insecurity in Saskatoon. An emergency shelter is a short-term intervention, and I think we really want to focus on what are the longer-term interventions to address housing insecurity in Saskatoon, and particularly, and so work with those partner agencies on that. For opening up civic facilities for vaccinations, the way it has worked from an EMO perspective is somebody like SHA comes to us and says, we need this resource. And they clarify what they need in the resource, what's important. So they want a place that they can do drive-through. They want a place with good parking. They want a place that they can move, thousands of people through a day. And we go out and we locate that resource for them and say, here are some opportunities for you. And so one of the risks in emergency management, and one of the things that sometimes occurs, is when a big event happens. So when we've had evacuees from the north, or when when people like at Fort Mac and Slave Lake, unless you know what the gaps are and the agency of jurisdiction is telling you what they need and you fill that gap, you can wind up with excess. And so very easy. For instance, we had evacuees from the north, and everybody was really, wanted to reach out and help them. And so people were dropping off couches and dropping off things. And the reality is the evacuees came from the north on buses, and they were going back on buses. And so having 6 couches actually just created another bit of an emergency. What are we doing with these couches? Because they can't go back. Mm-hmm. So I think we really want to have the SHA tell us what their gaps are, and then we as the city work with our partners to fill those gaps for them. So.
Thank you so much for that. Thanks everyone for letting us kind of put you each on the spot with a targeted question, but just with your expertise in that, you guys are the best to answer those questions. So I'm going to throw this now to Manura, who's got a question that he wants to field out to whoever is able to answer before we kind of go into a closing round through Anika. And just again, thank you so much here for spending this time with us.
Yes. Thanks, Lenore. The question I had is, what is your take on the increase of discrimination and hatred towards people who are immigrants, especially Asians and other people of color, that has happened because of COVID? As an example, I can point out the unfortunate event that happened at the Mice Kitchen in Saskatoon. Whoever wants to go first. Anyways, thanks, Ben.
I don't mind going first because Mice Kitchen is our neighborhood restaurant, and we live about 2 blocks away from there, and that's somewhere we've been regularly, somewhere we've ordered from throughout the pandemic. And my teenage daughter works next door at a business next door. And what occurred to me is that our whole community is under stress, and that when you're under stress, I am an old social worker. And we know, in families and in community groups, when things are under stress, the worst part can often come out. And the reality in our society is racism is part of our society, discrimination is part of our society, and we need to acknowledge that. And we need to acknowledge Saskatchewan's history with that. What I took away from that was the way our community stood up for Mice Kitchen. And, I looked at all the restaurants who were saying, please order from Mice tonight, not from us. And I think that's it, that, we need to make racism and discrimination unacceptable in our society. And I think it's been a slippery slope here during the pandemic. And I think things that were normally underground have come up. But I think the rest of us need to stand up and be allies. And I think we need to stand up and say that's not acceptable, that that's wrong, and that that is not the way we're going to act. And I think the more the rest of us stand up, the better. But I think if we quietly allow these things to happen, and these are, you know, mine was a very public thing, but there are lots of private, small things that happen all the time. And I think if we don't stand up for those small things, those big things will happen more often. So it is on all of us to stand up and say no to that.
Maybe I could just add some things from my own experience. So during the 25 and a half years that I served as registrar at a college, at many points, over 50% of our physician workforce came from elsewhere in the world, and from very diverse array of countries. And then I worked for a while as the CEO of SaskDocs, which is the physician recruitment agency. And it would just anger me when sometimes community leaders would say to me, we want a white doc. We don't want one of those doctors from wherever they've named the country. And I'd say to them, quite frankly, you know, with that attitude, I don't think you should have a doctor here, because people come from everywhere in the world with skills that they bring to our country. They enrich our country culturally, economically. And I guess one of the things I've learned in life is we sometimes pretend that racism doesn't exist in our culture, and it does. And when it raises its ugly face, we need to call it. We need to challenge people. Don't laugh at jokes that are racist. Tell people you don't want to hear that again. That's what I would suggest.
I don't mind building on that briefly as well. You know, it's concerning that when people are under such distress, their worst selves comes out, and it is showing us how present racism is. And I guess what's concerning when we're not under so much stress, how much of it is actually hidden. So we're, you know, it's like we're getting the transparency of it in some ways. But I wanted to just put a shout out to the university for appointing Dr. Verna St. Denis as an advisor on anti-racist education, because I think a lot of this relates to the importance of education, the importance of understanding the history in Canada around colonization, around residential schools. And I was just so pleased to see that move on the part of the university. I think that Verna will really be able to embed a different way of thinking and allow everyone to apply a different lens to how we approach these issues. So some gratitude there.
I'll just jump in, and I may have a unique perspective, both being from a Middle Eastern background. But before I jump to my comment, I need to correct Pamela in one thing she said. She said she's an old social worker. She meant she is a young, previously social worker. Just need to correct the record here. I'll answer and I'll jump in here with a comment. And I wrote a piece not too long ago for CBC about racism in medicine. And it actually, the incidents that we're seeing here highlights something really important, whether the incident at this restaurant or the incident against Dr. Saqib Shihab highlights something that's very important, that nobody is immune from this. I mean, we're talking about the number one top, extremely impressive physician in our province. I mean, we're talking about someone his resume are pages and pages and pages long, and he is not immune from this. So I think this is an important thing to understand, that nobody is immune from this disease. And if we don't all stand up for it, it will affect all of us. That's the first point. The second thing that I think is important to mention here is that, and I like to always bring this back to our Indigenous population. I think that they have received and continue to receive the most amount of discrimination in our nation's history. And unfortunately, oftentimes they do not have the advocacy that many other people have. Like, as a powerful physician in the province, we're able to speak for ourselves, and we have platforms to speak for ourselves. But I have to say that Here in Saskatchewan, as a Middle Eastern man, I always felt welcome. I always, even when anybody makes any unfortunate remark towards me on Facebook, very quickly, what my mom refers to as that my fan club are quick to defend me and quick to state that their parents who came from Germany or Ukraine had similar experience, but that I'm welcome here and that they're glad to have me here. I think that, as everybody mentioned here, we cannot be silent about these things. We could disagree with each other. We could agree and disagree on restrictions. We could agree and disagree on lockdowns. We can agree and disagree on anything and everything. Everything should be out for discussion. But one thing that is an absolute red line and has to be condemned by everyone, and we have to speak very loudly against, is racism. And unfortunately, even though the majority of the people are decent, good, welcoming people, there is a small percentage of people that is loud. And the only difference is that now everyone has an iPhone or another. I'm not trying to make an ad for iPhones here, or some other device, and they're able to capture this and call it out. I'll mention this. My mom is obviously Middle Eastern, and she wears the head covering. And I know personally that sometimes when she's alone, if I'm at a store or something like that, if she's alone, I will notice a different treatment sometimes. But if I'm around her, then that treatment is different. And I think that if you witness a behavior like that, I think we all have the responsibility to call that behavior out. Many instances we've noticed where people, like for example, at the rally, when I spoke against the rally, I said, because people said, oh, we don't agree with that gentleman that said these words against Dr. Saakib. Well, why don't you speak up? Because I promise you, if anyone in this panel or anyone else, if I was to, or anyone else was to say something that's condescending towards a race or a group of people, the rest of this panel would speak up and say, what? No, we don't agree with that, and speak up. So I think that we cannot say, oh, we're trying to be politically correct or we're trying to be peaceful. This is something that we cannot tolerate, not small amount of it, not little of it, not any of it. Racism is an ugly, ugly disease that eats at the core of our society, and we need to speak very, very loudly against it because it's not gone, and we cannot allow it to grow in our society.
Thanks a lot. Over to Anika.
Perfect. Thank you to all our panel members for sharing your wisdom and responses. We would now like to ask each of you to please share any closing reflections you may have with the audience and any new guidance or advice worth repeating, starting with Dr. Kendel.
Okay, well, I want to end on a positive note. I've lived in Saskatoon since I came to go to university here, and I actually consider it a blessing to live in this city. It is, for the most part, a really good place to live, and we've raised our family here. They now have moved on elsewhere, but I'm hopeful that every one of our citizens will just redouble our effort to reduce community spread of the virus. Each of us can do our part, and I would just urge each of you to do that so that we do get the spread under control and we don't overwhelm our hospital system, and we can get back eventually to more normal life. So please do that. Thanks.
Thank you so much, Dr. Kendel, and over to you, Dr. Masri.
I think that the positive note is important here, and I think that the people in this province have done a lot of sacrifices. I know many business owners and many people who have done a lot of sacrifices to get us to where we are. And even though we might be not the best in terms of per capita cases, we have done well overall, and I know that we can do better. I want to remind everyone here is that the pandemic is not endless, and the pandemic is not going to last a lifetime. And I know that even as early as this summer and the fall, we will have better days. When I moved to Saskatchewan, almost hard to believe, but almost 6 years ago, people kept talking about going to the lake. And in my simple Ontarian mind, I thought that the word the lake meant like one specific lake, until finally I reached out to someone. I said, what is this lake that everyone going to? And it turns out there's obviously thousands of lakes that people go to. And I want to remind people in our beautiful city, in our province, that those days are coming, that better days are ahead, and that we need to face this problem head on, because not talking about COVID-19 and not facing the problem does not make it go away. If it did, if not talking about the problem would make it go away, I would be the first to deactivate my Facebook and never mention the word COVID-19 ever again. But unfortunately, not talking about our own problems does not make it go away. We got this. We can do better. We will do better. And some amazing, incredible days will be ahead. I look forward to having this specific panel maybe a year from now in person, sitting next to the very young social worker and the youthfully young Dr. Kendel and the amazing Tracy and everyone here in this panel. And I want to remind people that this is a reality. We're all laughing and trying to imagine this moment. But just like this pandemic spurned on us out of nowhere, good days will be here. And people will be like, oh, remember when we all, for some odd reason, met via the phone with a camera and talked, not in person. This will be history, and good days are ahead. I'm really honored to be in the presence of all these amazing people. I know I talk a lot, so bear with me. One last thing I want to say is what Dr. Kendel said about what I've seen in this pandemic is that we have some amazing women running our country. Look, the vaccines that are coming to our country, the minister in charge of that is a woman. Our top physician is a woman. Most provinces' public health physicians are women. Our CMO is a woman. The amazing panel over here is there are 4 women, 3 men, and it really is important to highlight that. We have come a long way. We still have a way to go, but I will not be fair without highlighting the power of that. Some of the other very active people on social media, like Dr. Hines, like Dr. Sullivan on Instagram, are women. Women have left an impact and will continue to leave an impact. And I promise you, my mom did not make me say all of what I just said.
Perfect. Thank you so much, Dr. Masri. Now you got me dreaming about the time when we all can hang out in person. Perfect. And now over to you, Tracy.
Yeah, I guess one of the messages I'd like to leave is to remind people that we have amazing testing capacity that's not being used. And I worry about people that might have some mild symptoms or might have been in contact with others. There's a lot of capacity to be tested. So please be tested if you have any concerns whatsoever. And when you are vaccinated, tell your friends and encourage them to go get vaccinated as well. One thing I'd encourage you to do over this weekend is to think about someone in your life who is not able to get out and could use a phone call. Like we talked about earlier, there's many older people out there who are shut in their homes and would appreciate a phone call. I would like to encourage people to do that and validate, the experiences that people are having through this experience. If people are not feeling up, try to validate them and give them some of your time. And I'd recommend also following Dr. Tamara Hintz on Twitter, because when you get into the banter between Dennis and Tamara and others, it's very informative and sometimes entertaining. So thank you for having me. I really appreciate it, and I appreciate the many messages that we get at St. Paul's Hospital to encourage and support our staff. It does really mean a lot. Thank you.
Thank you so much, Tracy, and on to you, Pamela.
Great. Well, thank you. And I think, my closing thoughts, similar to Dr. Kendel, is, this has been hard, and I think it's important that we normalize how hard this has been and how challenging it has been for everybody, and that it is normal and healthy to feel anxious, to feel upset, to feel angry about how things are going. But I also feel very grateful in the role of Director of Emergency Management. none of us can do this on our own. And so what strikes me about Saskatoon and compared to other jurisdictions perhaps, but I think in Saskatoon, we work together really well. It is rare that when we call someone up and need something that they say no. It is more likely that say, we'll get that for you, we'll figure it out. When I look at the partnerships that SHA has built, it's so essential. And I think it all comes down to relationships. Here in Saskatoon, I think we do relationships well. We do how to work together well. And I think it's important to remember that in emergency management, we say we never want to meet you for the first time on scene. The first time we meet you, we don't want to meet you in our command unit or in our EOC. We want to know you. And I think in Saskatoon, we do that. We know each other and we work together well. And we work together because we know we have to. This is not up to one organization, one individual, one group to solve. This is all of us working together. And so I think we need to do that respectfully. And I think we need to be open to when we've made mistakes and working together with each other. But I just want to express gratitude. You'll see Randy Golden popped up here. That's my mom. There is nothing that I do that she's not a cheerleader for. And also I want to express gratitude to my family. I've been absent a lot this year in our family life. And so I really appreciate, there's my mom again. Thank you for the conversations. Thanks, Mom. So thank you very much, everyone. Take care.
Thank you so much, everyone. And over to you, Lenore.
Yeah, I just want to say thank you. Thank you to the listeners first, because that's what makes this show. And what also makes the show is the panelists, to both our panelists and to the listeners. On the back end, I just want to say thank you to my co-host, Anika, and to my other co-host, Madira, who I always screw up with your name. And I just call you the mad guy behind there that's watching everything, which I love. To Jeff Jackson, that's been handling traffic back there, and to Rashid Ahmad as well. Between the Voice of Saskatoon and Civically Speaking, we're hoping that we're bringing something that will continue along with our new media partner here and the partner that we have with CFCR. So thank you, Ian Roach and Deborah and Dennis of No YXC. We are very thrilled to have this media partnership so that we can bring this kind of multiple channel viewing to Saskatoon so that we can share shows like this. So again, once again, just thanks, panel. Much wisdom. We will have you back. We got to check in because we know we're in the midst of this. It's not going away. We got to be safe. We got to wash our hands, and we got to wear a mask when we need to. And we got to show ourselves love and kindness as we head into this family weekend and Valentine's. So thanks so much, everyone. Be safe out there.
Thank you.